Hello everybody and welcome to the Tuesday edition of Video Clips. I hope you all had a wonderful Thanksgiving weekend. And I'll start with just a couple of announcements. Believe it or not, I'm going to give you the last two events of the 2013 calendar year. First of all, next Tuesday, December 10th, is the last Conversations with Dr. Pam. I'm going to be talking about genetically modified organisms and give you the straight scoop on what I think about this and how it affects people and all that sort of thing. And then, of course, the rest of the time after we cover that topic, you can ask me anything you'd like about diet and health. And then our last Intro to Plant-Based Nutrition is scheduled for next Thursday, December 12th. So I'll remind you again next week, but you can mark your calendars. And then that's it. We take a well-deserved 3-week break here at Wellness Forum and then return with phenomenal programming in January. So the topic for today is obesity. And I have two articles I want to talk about. And the first one is a follow-up to a report that I issued earlier this year. The American Medical Association's committee and the AMA voted to label obesity as a disease. And at the time, I stated that this wasn't going to help obese people, but that it would help doctors, drug companies, and medical institutions to make more money. It's also going to help lawyers and probably hurt employers, which I'll explain here. Now that obesity is considered a disease, it's going to be easier to get new drugs approved to treat it, and insurance companies are going to have to pay for these drugs in addition to paying for more bariatric surgery. After all, the standard treatment in our country for just about anything is drugs and surgery. But as I mentioned, this disease categorization is likely to hurt employers too. Obese people will have better standing in claiming discrimination under the Americans with Disabilities Act. According to an article in Employee Benefit News, and this is a quote, employers need to treat obese individuals like they would treat anyone else with a disability, end of quote. The reason is that, quote, a disability is defined as an impairment that substantially limits a major life activity, end of quote. I guess like working, I suppose. Previously, there was some debate over whether a claimant needed to be able to prove some underlying psychological disorder or metabolic problem that caused the obesity. But now, being obese all by its lonesome self is categorized as a disease, and this will no longer be necessary. According to the article, this means that employers will no longer be able to base decisions like hiring, firing, promotions, raises, and compensation with consideration of whether or not somebody's obese. Now, in principle, I agree that obese people should not be discriminated against. An obese person who's capable of performing a job should be given that job and paid just as much as a normal weight person. But this law may cause the very discrimination that it's supposed to prevent. The article advises employers to develop a very clear job description before hiring that describes the physical requirements of any position. The unspoken message is clear. Avoid hiring someone who could potentially claim later that their weight doesn't allow them to perform a job. Employers will shy away from taking chances with people because they cannot afford to take on future disability liabilities. Another potential liability issue is the definition of obesity, which is not real clear in the AMA guidelines. American guidelines in general, established by the CDC and the World Health Organization sort of plays along with this, are quite liberal, defining obesity as a BMI or body mass index of 30 or higher, while in other countries a person can be considered obese with a BMI of 25. Now, I agree that our guidelines are too liberal, but I worry that enterprising people and their lawyers will attempt to use these more liberal guidelines, helping more and more people to claim disability benefits. I've personally known people who've tried to game the system to collect disability benefits, claiming injuries on the job, which I have good reason to believe were not valid. I'm sure this will keep lawyers and the courts busy for a very long time, and the unfortunate part is it really distracts from what helps obese people, the right diet and lifestyle. We just ignore that while we get all tied up with this ridiculousness. So I think this is the beginning of lots of negative things that are going to come out of that decision, which didn't seem very important at the time, but becomes more important as these types of things unfold. Now, while we're on the subject of bad news, I'll give you some more about obesity. According to a recent study, information about nutrition and obesity is often misreported in medical journals. In fact, according to this most recent study, 1 in 11 articles on nutrition and obesity exaggerates the benefits of weight loss interventions by confusing correlation with cause and effect relationship or generalizing a study's results to the general population when the study participants were quite different from the general population. The researchers reported that the problem is that this can, quote, without intending to, distort the state of knowledge and inappropriately influence clinicians, decision makers, the media, and the public. The researchers searched for research articles published in 8 leading journals between 2001 and 2011, and the reason for the time span was to see if the problem's getting worse. The group identified 377 papers published in 2001 and 560 in 2011. 8.9% of those articles had evidence of overstating results in the abstract, and the papers published in 2011 were more likely to overstate than those published in 2001. So the problem is getting worse instead of better. Interestingly enough, and not surprising, the researchers determined that funded studies were more likely to show signs of overstating than non-funded studies, and it didn't matter what type of group was providing the funding. When there were more co-authors, the likelihood of overstatement was significantly less. In other words, when there are more people looking at this, and I think that's a major issue, is not enough people lending a critical eye to research when it's being structured and conducted. Obesity is now our leading health issue, with estimates that 60% of the population may be obese, and it's important that this issue be addressed, and even more important that it be addressed properly. And one of the reasons why people fail to lose weight is that most weight loss strategies don't work, and one of the contributing factors is the proliferation of inaccurate information. I've seen firsthand some of this misreporting as it pertains to obesity. The topics includes things like attributing obesity to genetic predisposition, observing differences in gut bacteria in obese people and reporting that fecal transplants might help people lose weight, or attributing weight gain to certain hormonal fluctuations when there's no evidence that these levels cause obesity or that manipulating them would result in weight loss by itself. All of this distracts, again, from what really does work. Low-fat, plant-based diet combined with exercise and the right type of therapy to reframe thoughts and ideas about food and eating. Now, I've been reporting on misreporting for a lot of years, and my purpose is not just to be negative and criticize, but rather to point out to both health professionals and lay people that it is important to look beyond news releases and sound bites about research results before applying them to your own life or in practice. There is often so much more to the story. And I hate to say it, but a lot of times the story isn't right to begin with. So very important to learn about this stuff and not jump off the cliff every time you see some headline suggesting we've unraveled the secret to obesity, and it doesn't involve you having to change your ways. You know, there's a saying that if it sounds too good to be true, it probably is, and I agree with that. Well, anyway, that's all for now. Have a wonderful day. I'll be back to you on Thursday, and as usual, please pass this on to anybody who you think would enjoy watching it.